Hi, my name is Billy. I'm going to be your nurse today. Can you kind of get two patient identifiers?
Yep. Christina Thompson, date of birth is 10. Oh, wait, just kidding. 05/10/95. Sorry.
Okay. So I'm going to be doing a head to toe assessment on you today. That means we're just going to go from your head to your toes, kind of give you an exam. Um, just before we start, I'm going to give you some privacy. Make sure the curtain's pulled. I'm going to make sure the rails are up on the bed so you don't fall out. I'm going to make sure the bed is raised so that I can properly work with you for my safety as well as yours. Should be high enough. I am going to wash my hands before we start. Okay. I do just have a couple questions before we start. What do you do for a living?
I'm a nurse.
Okay. So, how long have you been a nurse?
Probably 6 months or so.
Okay, so with your height and weight, it's proportional to your lifestyle. You look like you're good hygiene, clean clothes. How is your mood today? How do you feel?
Good.
Okay, good. All right, so with that, we're going to go ahead and start. Your head is normal cephalic. It's normal shape. We're going to palpate. Does any of this feel tender to you?
Nope.
Okay. Your head is, the scalp is pink, warm, and dry. There's no lesions. The hair is full. It's directly proportional across the scalp in a good way. The hair color is brown. It's full. I'm going to check around a few areas just to make sure we don't have any pests. Look at the neckline. Okay, so the hair looks good. Head is normal. Okay, I'm going to have you smile at me. Okay, now frown. Alright, now stick out your tongue. Alright, and blow your cheeks out. Okay, so your facial alignment is good. Your ears are symmetrical to your face. Your nose is midline. Your eyes are symmetrical. Okay, so from here, we're going to look at your eyes. I'm going to look at your, they're green. Sclera is white. Conjunctiva is pink and moist. Eyelashes are spread proportionally across the eyes, as well as the eyebrows are spread proportionally across the top of your eyes. I'm going to check the reactivity of your eyes now to light. Okay, the pupils were about a 3, and with reactivity, they went down to a 2. Okay, can you follow my pen light? Okay. Now just keep your eyes on the tip of the pen light. Try not to move your head. Okay, good. The ocular movements are all good. Your eyes are reactive to light and adjust to near and far. So now we're going to look in your ears. Again, your auricle are symmetrical. They are warm and dry. They are both elastic and normal. The rest of the ear is warm and dry. It's symmetrical. We're going to look inside. I see no lesions, no discharge, no redness. Earwax is minimal. You do have piercings. This ear is symmetrical. No lesions found, no discharge, minimal earwax. Okay, so I want you to occlude your right ear. Okay, I want to put your hair between my fingers and see if you hear that.
Yep.
All right, I'm going to try this one as well.
Yep.
Okay, so hearing is intact. We're going to go look at the nose. I am going to palpate the bridge of your nose. Is that tender?
Yep.
Okay, so no abnormalities found, no breaks, no mass, nothing like that. I'm going to go ahead and feel your sinuses underneath your eyes. I'm going to see if you have any tenderness.
Nope.
No tenderness. Above your eyes, around your ears, no tenderness. Okay, so your nose is midline. I'm going to look up into it. The septum is also midline. There's no lesions. You do have a piercing in your left nair outside of your nose. It looks normal, patent. No discharge, no masses, Any irregularities? Okay, can I get you to occlude one side, breathe out the other? Occlude one side, and breathe out the other. Okay, so then there's your patent. If I had an alcohol wipe here, I would put it under your nose and see if you could smell it. That's how we would identify her sense of smell. From here on, we're going to go down to the mouth. The mouth is pink and symmetrical. It's moist. Can we open your mouth? All right, so your buccal membrane is pink and moist. I see no lesions. Teeth are straight and white. I see no dental caries. Can you stick out your tongue? Tongue is medial. It's moist and it's pink. I see no lesions. Can you say ah? Okay, so your uvula is midline and raised. Good. Your oropharyngeal is, there you go, left to right. Move your tongue left to right again. Your oropharyngeal is moist and pink, and I see no lesions. Tonsils are noted to be +2. No discharge, no abnormalities, no lesions. Okay? That's good. So now we're going to move down to your neck. I'm going to assess your trachea for being for midline. Any tenderness? Okay, I'm going to palpate your carotid on your left side, on your right side. They are +2 equal bilateral. No tenderness. I'm going to listen to them as well. When we listen to these, we're going to be listening for a bruit. So both sides of my stethoscope. Okay, no bruits were heard at this point. The neck is warm, dry, and intact. I'm going to feel for your lymph nodes now. You have your preocular, postocular, occipital. You have your anterior cervical, right here. Posterior cervical, deep cervical. And then you have your submental, submandibular, and then you have your supraclavicular. And for the purpose of the video, I would check her axillary lymph nodes as well, which would be under her arms, here and here. So no tenderness in the lymph nodes.
Right.
No tenderness. Okay. I felt no inflammation. Nothing was out of range. Okay. So from here, can you look up for me? Look down. Look left. Look right. Okay. Can you move your face against my right hand? There you go. Left hand. Okay. Can you put pressure against my shoulders? Okay. Her neck has full range of motion. She has adequate strength bilaterally in both her shoulders. From this point, we're going to look at her lower extremities. So she's got her brachial pulses are right here. They are +2, equal and bilateral. We have a radial pulse here. They are equal and bilateral. Alright, so her skin on her arms is warm and dry. It's pink. We're going to look at her hands. The hands are also warm and dry and pink. The nails are clean. They're short. The nails are pink. Capillary refill is less than 3 on both hands. Skin turgor is immediate. From here, I want you to rotate your wrists out. Okay. Can you bend your elbows in? Okay. Can you turn your elbows in a circular pattern? Okay. Can you shrug your shoulders? Okay. Can you push against my hands? All right. Can you pull? Can you squeeze? Okay. Her range of motion in her upper extremities is full, and her strength in her extremities is strong bilaterally. Good. So now we're going to move on to her lungs. All right. Listen. Take a deep breath. Okay. Her anterior side is the lungs are clear. I'm going to go and check the back now as well. Just take a deep breath. Okay, her lungs are even and her lungs are clear, posterior and anterior. Her breathing is regular, unlabored. All right. From here, I want to listen to her heart as well. Okay, and I'm going to be using both sides of my stethoscope, the front and the bell. Here we have our aortic. And then we have our pulmonic. We have Erb's point. Okay, then you have your tricuspid. And then finally, you have your mitral valve, where you also will listen to the apical pulse. I will listen to the apical pulse for 1 full minute. Okay, her apical pulse was 72, and the heart sounds, the S1 and the S2 are both heard, so she is good. At this point, I'm going to have you lay back into a supine position. And for the purpose of the video, I'm not going to raise her shirt up due to her preference, but in real life, I would pull the shirt up and look for any abnormalities, any lesions, and anything abnormal. Okay, the stomach is flat and it is even, it's symmetrical. I'm going to auscultate it for to find any abnormal vowel sounds. Okay, There were active bowel sounds in all 4 quadrants. At this point, I'm going to palpate your stomach lightly, and if you feel any tenderness, let me know. Okay. If she had been experiencing any kind of urinary retention, I would palpate the suprapubic to look for any distension. None was found. I am going to move down to her legs. At this point, I see that her legs are dry and pink and warm and intact. I'm going to feel for the popliteal pulse on both sides. Let's look at it under the knee. Okay, it's +2, bilateral, which is good. I'm going to look for her posterior tibial, which is in the side of the ankle. That is +2, bilateral. All right, and then I'm going to look for the dorsalis pedis, which is on top of the foot, which is also +2, bilateral. For the purpose of the video, we also have the femoral, but we won't do that. But we would check that in a real life scenario. I'm going to check the strength of your feet now. Can you push against my hands? Push against my hands. Can you rotate your ankles? Okay. Can you push against my hands here with your leg? Push against my hand with this leg. Okay. I'm going to move this knee up towards you slowly, and then we're going to kind of frog out. Up and then out. No, back down. Good. Up. Out. Back down. Good. So your range of motion of your lower extremities is all good, and your strength is good bilaterally in both your legs. So there's no problem there. Your capillary refill is less than 3 on your feet. We are going to lower the bed, and I'm going to check your spine. You only kind of lean back. That sitting position. Okay. I would see that the skin is warm, dry, and intact. I would, in real life scenario, I would look down the back of the shirt and see. I'm going to palpate the spine, look for any kind of variance or abnormality. It's in a midline. There's nothing there. I'm going to percuss the CVA for any kind of tenderness. Any tenderness? No tenderness. The spine is in line and intact. Okay. So at this point, I'm going to have you close your eyes. I'm going to test your light touch senses. Okay. Wherever I put this tissue, I just want you to let me know where you feel it.
My left cheek. My right arm. My left hand. My right leg. My left leg.
Okay. So you passed all that. Your senses are good. You feel it. At this point, I want to evaluate your posture, sitting. You have good posture. I'm going to have you stand up slowly. All right. Your standing posture is good. I'm going to have you walk about 2-3 feet that way. Your gait is good, your coordination is good, and your body posture is good as you walk. You can take a seat. Okay. This concludes our head to toe assessment. It all went really good. I will see you later in the updates.
All right.